My name's Nicola Wyllie and I'm the Senior Charge Nurse of the Vascular Access Service in NHS Greater Glasgow and Clyde in Scotland. We are a nurse-led service and we have sessions in the 3 main acute hospitals in Glasgow. We also attend ambulatory care hospitals, hospices and mental health facilities for satellite sessions when required. We began using Smartmidlines around 12 months ago and we've inserted in excess of 300 devices in that time. We originally piloted the Smartmidline in our cystic fibrosis patients, and that's because those are a patient group that require reliable venous access for the administration of their intravenous antibiotic therapies. We had used another midline device prior to the Smartmidline, but we found that it failed often before the completion of prescribed treatment. Cystic fibrosis patients often have challenging or difficult intravenous access because they require frequent access for the administration of their antibiotic treatments. As a service, we receive referrals often for patients with difficult intravenous access. We often get the referral when the patient has had already multiple failed attempts at cannulation. They report discomfort, they report peri and post-insertion pain, and often they can be needle phobic by the time they've been referred to our service for reliable venous access. Patient groups who have particularly challenging vascular access tend to be patients with high body mass indexes, patients who inject drugs, patients who have been receiving medications that should be delivered centrally through a peripheral cannula and it's resulted in vessel damage. We have more recently been receiving proactive referrals for patients with difficult vascular access who require CT, so patients who require contrast enhanced imaging. Historically, what would happen is patients would arrive in the imaging department, cannulation would fail and the procedure would be abandoned. These patients are now being highlighted as difficult intravenous access patients and they're being proactively referred to our service, which means they are getting a much better experience. It also means that there is improved service efficiency for the imaging department as they're not having to cancel procedures and then re-request them. We particularly like the Smartmidline device because it uses a Seldinger technique for insertion. That means that there is less damage to the intima of the vessel and the resultant venous spasm is reduced. The kit itself is particularly good. It comes with one of the best insertion needles I've ever used. The needle allows ease of access due to its sharpness and it's very lightweight. The kit also comes with a bright green label which alerts the user to the fact that it is a peripheral cannula. It also provides the user with a PSI for CT, which is very good for patient safety. Not all devices that we use have that information so visibly. We receive really good feedback for the devices from our patients and from the referring specialities, and they say it is due to the ease of use and the fact that it can remain in situ for duration of treatment.